Officials are working to fine-tune the National Health Insurance Plan before a crucial phase is launched. Cleopatra Murphy explains.
The National Health Insurance Program is being retooled as the National Health Insurance Authority lays the legal and policy framework to introduce catastrophic care within the next year. Minister of Health Dr. the Honorable Dwayne Sands says he has confidence in the board that is working diligently to introduce a quality product.
We envision this to be a contributory plan. The details will be forthcoming. In my last communication from the chairman of the board, Dr. Robin Roberts, we anticipate certainly looking at the first quarter of 2019. The challenge, of course, is making sure that you get it right.
During his budget contribution, the Minister of Health shared that the NHI Authority would introduce the Bahama Care Fund to manage the cost of NHI with contributions to the plan estimated at $15 to $80 per month. The primary care phase of NHI was launched in the first half of 2017. More than 1 year after, the Minister of Health says that the phase is still not where officials hope to see it.
The information technology platform is not in place. The monitoring, surveillance, evaluation tools are not in place. So, yes, there are absolute requirements to improve even on the existing NHI platform.
There are 33,661 people enrolled and benefiting from NHI's primary care services. In this year's budget, government has allocated $20 million to the health scheme and an additional $10 million as a contingency. Sands says the figure is down from the $40 million allocated last year.
We didn't spend $40 million last year on national health insurance. And we don't know how much we're going to spend this year. It really depends on how quickly the catastrophic care plan is rolled out. There's no shortage of an appetite for funding for healthcare, but you have to do it fairly. You have to do it with some semblance of order. Otherwise, it becomes a free fall.
Sands says $10 million of NHI's budget was utilized to close the deficit at the Public Hospitals Authority. Cleopatra Murphy, ZNS Network News.